So it is with great pleasure today that I introduce Martha North. She is a family all ages nurse practitioner working in Labrador. She completed her Master's in Nursing Nurse Practitioner program through Memorial University in 2019, where she began working as a primary care nurse practitioner. She then completed her opioid dependence treatment certificate program through CAMH, and now she is a working permanent full-time as a regional NP for the opioid dependence treatment program in Labrador Grenfell Health. She's also the secretary for the Newfoundland and Labrador Nurse Practitioner Association, the NLNPA. She's very passionate about harm reduction work in the province and advocates every day for a more inclusive, less harmful healthcare system when it comes to marginalized and vulnerable populations.
Of course, today I will be discussing the role of the nurse practitioner, inclusive of all of its scope and where you may find us working. And I just always love the opportunity to discuss and educate and inform individuals on the role of the nurse practitioner. I feel like there is quite a bit of misinformation or perhaps even just lack of information on what a nurse practitioner is, where they may be found, and what quality care and healthcare provision they can be given by a nurse practitioner. So I'm really excited to be able to speak today about exactly that. Yeah, and nurse practitioners play a very important role in our healthcare system. So hopefully you guys can gain some of that knowledge from this presentation. So on to the objectives. Let's see. So the objectives today, first we'll be defining what is a nurse practitioner. We're going to be describing the scope of practice of a nurse practitioner, list the areas of practice that you may find various NPs, highlight the benefits of the nurse practitioner in our healthcare system from both evidence and client outcomes, and summarize the role of the nurse practitioner. And then of course at the end we can have a nice question and answer period or comments, whatever may be needed. So just quoting from the College of Registered Nurses of Newfoundland and Labrador, what is a nurse practitioner? So nurse practitioners are registered nurses with advanced educational preparation and experience, which enables them to autonomously diagnose, treat, and manage acute and chronic physical and mental illnesses. As advanced practice nurses, they use their advanced knowledge and nursing knowledge and clinical knowledge to analyze, synthesize, and apply evidence to make decisions about a client's health. And what I really want to emphasize in this definition is that we are autonomous providers. So we do not require any other discipline to kind of supervise or care with us. We are completely autonomous providers, and we have the abilities, both assessment skills and diagnostic skills, to provide healthcare to both acute and chronic disease across the lifespan. So there are various types of nurse practitioners. You can do your practice, your degree in both family of all ages, which means you're caring for an individual across the lifespan. That includes anything from newborn to older adult care. And you do actually specifically have to complete this degree as a family of all ages nurse practitioner and complete the national exam at that level as well to be able to care for individuals, for instance, in the pediatric aggregate or in the older adult aggregate, things like that. So this one allows you to care for individuals across the lifespan. There's also the option of being just an adult nurse practitioner, which allows you to care for individuals above the age of 18 years old. There's pediatric nurse practitioners that care for individuals from anything below the age of 18, so newborn to 17 years old inclusive. And there are specialized nurse practitioners as well, where you actually do require additional education to provide that expertise and that expert care. You may see that in very expert areas of work like gerontology, so specifically to that older senior aggregate, neonatology, so kind of experts in neonatology, because family of all ages, we can still care for the newborns as well as pediatric, but we're not experts in that age group. We're able to just provide that kind of primary care service for basic health, acute and chronic illness. Intensive care units, you can see very specialized nurse practitioners with advanced scope of practice in regards to advanced knowledge and skills with intensive care. There's addictions medicine, opioid agonist therapy. Like myself, I've done additional education to be able to provide that care. And there's much, much more. This is just a little synopsis as to what specialized care and education can look like. So the scope of practice of a nurse practitioner is quite extensive. We have quite a large scope of practice. So we're actually capable of performing comprehensive physical and psychosocial assessments. So this includes both complex and comprehensive history taking, as well as physical examinations and special tests to really identify problem areas based on a symptom, like an umbrella of symptoms, and then as well diagnose based on our physical and history exams. And this allows us to really fine tune our diagnosis based on our comprehensive ability to both take history as well as perform physical exams. We can order and interpret tests. So this includes labs, imaging, and other diagnostics, which I'll be going into in the following slides. We do have the ability to, with all of our various assessment tools and diagnostics, we are actually able to determine a diagnosis and both acute and chronic in nature, and treat those ailments associated to whatever diagnosis we come up with. We're able to formulate treatment plans for both common and complex conditions, prescribe treatments, both medication, of course, as well as non-medication things such as immunizations and non-pharm treatments. So, an incentive spirometer, for instance, compression stockings, things like that. So those non-pharm treatments, we can absolutely prescribe those just to optimize that kind of that holistic type approach to care, because as we know, there's so much more in medicine than just a prescription medication, things like that. So we have to look at the full picture and kind of prescribe treatment plans that are according to biopsychosocial. So looking at the determinants of health, for instance, incorporating diet, exercise, support systems, safe housing, safe nutrition, things like that. Provide health promotion and prevention, education and teaching. And this is one of my favorite parts about being a nurse practitioner is offering really just comprehensive and good knowledge. I always say to individuals, you'll never hopefully leave my office empty-handed, for lack of a better word, because I feel as if the education and the health promotion and education that people obtain from nurse practitioners allows them to feel empowered in their own health. Like, if you don't know that this is full of bad fats and cholesterol teaching, how are you able to kind of be empowered in making those health changes? So being able to just educate individuals and being able to make healthy changes related to the education that a nurse practitioner can provide is pretty empowering and exceptional. And like I mentioned, that preventative education, because our healthcare system is really, we're in a situation now where we're very curative medicine. We're dealing with, chronic diseases that perhaps haven't had primary care providers, and it's not preventative in action. It's very curative. So nurse practitioners do typically really work on preventative medicine and providing that kind of education and health changes that can hopefully prevent those long-term health outcomes. So that's one of my favorite parts about being a nurse practitioner. Refer to specialists in other disciplines. Of course, we are not the only things that will help individuals' health outcomes, but we can be that liaison. So we can identify, I think a dietitian, I think a diabetic educator, I think physiotherapy, OT, all of those beautiful disciplines can also be incorporated into the care. And then we can see better health outcomes, of course. So I think collaborating with other disciplines is so important for long-term health, like good long-term health outcomes. So I really love that piece as well, that we can delegate to other disciplines when needed. We can perform advanced practice procedures. So, of course, suturing being an advanced skill, intra-articular injections, pap smears, IUD insertions and removals, castings, and the list goes on. We have quite an advanced practice procedure skills that you can obtain by mentoring. Some is within the NP program, and some are after mentoring with a various specialist or people comfortable with the advanced skill. All right. Screening and diagnostics, just a few continued. I just want to kind of elaborate for those who may not be familiar with just labs or that kind of broad term. So we can order everything from blood, urine, and other specimen testing. We can order ultrasound, X-ray, and CT scans, mammograms, pap smears, fecal occults, bone mineral density tests, stress tests, ECGs, cardiac echoes, pulmonary function tests, sleep studies, and so much more. I just thought I'd put a few of them out there just to kind of really hone in. I find there's a narrative that nurse practitioners can order x-rays and blood work, and it's just not the case. We actually look at whatever that symptomology may look like and fine tune it to the individual diagnostic that is pertinent to the symptoms showing up. So I think it's really important to know that we have quite a large a variety of things that we can order and interpret, and then of course diagnose based on those results. So we do have an increasingly advanced scope, and it continues to advance, which is beautiful. And I think we're going to only continue to see just more and more from the nurse practitioner. So we are completely autonomous, like I highlighted earlier, meaning that we have no supervising physician or other discipline around. We are able to order CTs, which have been a little bit, that's only in the last, I think, perhaps 5 to 10 years in our province. I could be totally wrong about that. Every jurisdiction is a little bit varied and different in what the nurse practitioner scope may look like in regards to CTs, MRIs, some of those little fine tuning. But in the province of Newfoundland and Labrador, CTs are absolutely ordered by us. Prescribed of controlled drugs and substances. So this is only in the last 5 to 10 years that we've had a large increase in our ability to prescribe just medicines for all diagnoses, which is beautiful too. Prescribing of opioid agonist therapy. So this is something that I've been trained in, and this is for the treatment of opioid dependence and opioid use disorder. And this is wonderful. A bigger access to nurse practitioners being able to do this improves access to this care, which is a life-saving medication. So that's wonderful as well. We see nurse practitioners doing medical assistance in dying, so otherwise known as MAID, medical cannabis. So you can just see the growing access to care if nurse practitioners can also do just plentiful work, if that makes sense. So where do you find us? Where do we work? So community care is one of our biggest kind of allotments of nurse practitioners, because we see both public and private nurse practitioners working in community settings. So primary care clinics, walk-in clinics, just varied collaborative care clinics. So some funded by the RHA and some private nurse practitioner clinics that are, of course, fee for service, pay out of pocket, due to the lack of public funding model for nurse practitioners. However, it's still beautiful to see just nurse practitioners growing in our community, because it does improve access to care. Everyone in the planet deserves access to primary care. So nurse practitioners being available in your community can improve access to just basic health needs and basic primary care. We'll see them in hospital settings, oftentimes in more specialized areas. So you may see them in hospital settings, in clinic, on floors like rheumatology. You may see them in neurology, things like that. So those are kind of more specialized areas, cardiology, things like that. But nurse practitioners are in settings across the hospital setting, long-term care facilities, a wonderful area for nurse practitioners, and you can see them across long-term care, mental health and addictions, like myself, for instance, cancer care clinics, and so much more. Like I said, just really you can find nurse practitioners anywhere if we look, right? So it's quite beautiful to see how much we have expanded in our practice and how we are improving care across all areas of medicine. So the benefits of a nurse practitioner. So it does wholeheartedly improve access to primary health care, because when we have issues with retention, for instance, with physicians, or especially rural and remote communities, perhaps there aren't as many accessible to a prescriber or a primary care provider. Nurse practitioners were really filling that gap in a lot of aspects, especially in our province of Newfoundland and Labrador, which is just so geographically challenged. So nurse practitioners really have have filled so many healthcare gaps by being able to provide healthcare to all clients in need. And like I mentioned, primary healthcare being preventative, not just curative medicine, as well as health promotion. So that's the mainstay. It really is improving access to that care. It reduces pressures on the healthcare system. It really does. Research shows that once there is better access in primary care or access to a primary care provider, overall ER visits are diminished, inpatient stays are reduced, and wait times are reduced as well. So we've seen huge benefits in that way in the research. We are valued and trusted by patients, and this has been reported both anecdotally but also in the research. So beautiful. Obviously, you can't ask for better. And we provide high quality management of chronic and complex illnesses, preventing negative long-term health outcomes. Because again, I just want to emphasize, looking at the full picture of an individual is so much more just wonderful, because if you're caring for that whole picture of an individual, biopsychosocial of that individual, you're going to prevent other perhaps exacerbations of a chronic disease or acute illness that can be managed if we just look at providing just really preventative and health promotive type medicine. So yeah, we just really do try to manage those chronic and complex illnesses to prevent that kind of negative health outcome in the long run, which would also reduce the burden on the healthcare system in the long run. So I developed this infographic back Nurse Practitioner Week of last year in 2021. And I just thought how wonderful if we can better inform the public and even other healthcare providers and health clinicians across the healthcare system, better understanding about what a nurse practitioner can do and what nurse practitioners are and where you might find them. So I did this little infographic just to try to highlight in the public, just exactly what this presentation has gone over, but just all the various scope of practice, what our educational background is. So, we're registered nurses who then accomplish a master's degree or an NP diploma, and we can work in primary healthcare, we can work in specialty areas, and we are autonomous providers. So we practice completely independently. So I thought that little thing, I was just going to show you that. And if anyone wants a copy of that, I also have that. So you can have that. So just to summarize, the role of the nurse practitioner, nurse practitioners take pride in providing a wide range of healthcare services to individuals across the lifespan. We do provide comprehensive and holistic care. So I just can't emphasize that enough, is that we look at the root causes of things. We treat people much more than just what perhaps that acute symptom may be. We look at the biopsychosocial aspects, determinants of health, and it truly does improve overall care and for the individual. And we thoroughly inform health information and care options to allow for that informed decision making, because patient-centered care is everything. It's not for me to dictate what an individual feels is their health goal or their what they want in health. I can provide them the necessary information to make the best health care outcomes or health information, decision making for themselves. So I find that's a wonderful thing that nurse practitioners can do, is provide all the necessary information, make sure that they are well informed and that they can make that decision making themselves well informed, if that makes sense. We provide equitable, safe, and non-judgmental care, and this should be unanimous across the board. It doesn't matter what determinants of health are affected. We should be treating everyone with complete non-judgmental care, trauma-informed care, equitable care, and it will just make for better health care across the board. If everyone feels worthy of care, then there should not be any, issues in our healthcare system. We are client advocates, which is massive as well. I find, especially in my aggregate, I care for many marginalized and vulnerable people, and oftentimes have no supports. So for me to be able to be that advocate and that support for an individual is one of the most empowering things. So being able to be, I think nurse practitioners, and perhaps, I think all care providers unanimously are advocates, I'm sure, for their patients, especially registered nurses and nurse practitioners. But it's just a beautiful thing to be an advocate for someone and support someone, that especially when the supports are lacking. And support clients in their health journey and whatever that health journey may look like. Like I said, providing the necessary information and doing thorough care, but allowing that individual to kind of be the pioneer in their care, and us just supporting them in whatever that may look like. And that's a lovely thing that a nurse practitioner can do.